Get started whenever. Yep. If you're ready. Ready? Okay. So I'm Mary Green. I'm a veterinarian, or the veterinarian at Lewis and Clark Veterinary Clinic. And so we're just going to talk tonight about mainly about losing your pet, deciding when it's time, that sort of thing. But we're going to start a little bit with kind of jump into more like senior pet care before we get to kind of looking at quality of life, pain concerns, that sort of thing. So so love is a four-legged word. So I don't think there's any question that pets are one of the most amazing relationships you'll ever have. And so it's wonderful to have them, but equally horrible to lose that friendship. So we're gonna spend a little bit of time focusing on how to care for your aging pet to hopefully keep them with us in good quality of life as long as we can. And then when we kind of hit that point where we're getting concerned, what are some objective ways that we can evaluate quality of life in our pets? And then when we determine that quality of life is absolutely a concern, we'll talk a little bit about the euthanasia process. So it's not so unfamiliar when you get to that point, if you get to that point. And then just some aftercare. What are some options for how you take care of your pet afterwards? And then bereavement. So grief is it will find us all at some point. When is kind of individual, but most of us don't get away from grief. So it will be there. So we're gonna define what is a senior pet just kind of vaguely. So if you look at the American Animal Hospital Association, they call it AHA. That is a governing body for veterinarians that sets the standard of care. You will find oodles of different definitions for what is a senior, but in general, for cats, it's over 10 years of age, and for dogs, it's the last 25% of their lifespan up until the end of their life. Where that becomes a little bit important is some of those changes that we want to start making really to help extend the life of our pets really should be before we get into the senior years. And then if we haven't made those changes before we get into the senior years, we definitely want to start making them once we get into the senior years. So yes, age is not a disease. That is something that we do hear frequently. And that our pet is so old or that sort of thing. And we absolutely, age has to be taken into the conversation and to kind of think about when we're deciding treatment courses. But it doesn't mean that we can't still help our senior pets age gracefully if we make some adjustments. For the next few minutes, we'll just kind of talk about how those adjustments relate to veterinary care and to home care. There are a lot of different ways to break this up, but for tonight, we're just gonna put some things that change at the veterinarian's office, and then some things that change at home, or that may need to change at home. So our senior pets should have twice yearly exams, yearly at a bare minimum. Our pets are aging at a much faster pace than we are, and so things do change rapidly. Their kidney function status, liver function status, all of that can change pretty quickly. New lumps and bumps will happen. Those exams, it should be looking at not only just heart and lungs and palpating abdomen, feeling organs, but we should be checking lymph nodes, aspirating any lumps or bumps that are there, checking ears and mouth, making sure that we are doing a complete blood workup too. That is checking the organ function of our pets. So when we think about things that we can do to help our aging pets, we've just got a few listed here that are kind of the top ones that we'll see. Arthritis is huge. Pain in our elder pets is one of the things that we have the hardest time with. It is one of those things where there are good days and there are bad days, and arthritis, it can be it can be very difficult because you will start to kind of hope and think that your pet is doing better for a few days, and then we kind of take a few steps back and that sort of thing. So we want to make sure that you're actively having conversations with your veterinarian about how you can best manage those conditions at home. There are so many things, whether that's just a non-steroidal anti-inflammatory to acupuncture, laser therapy. There are joint injections that we can do, joint supplements. There are sometimes over-the-counter joint supplements for work. Sometimes we move to prescription joint supplements, but a lot of things that we can do. There are some recent injections that have come on the market that can really help with pain and discomfort in our older pets. So, so heart disease. There are medications to help with how well the heart is pumping, medications to clear fluid from the lungs when it's not pumping well enough. There are diets out there that are meant to specifically support heart health, low in sodium, that sort of thing. There are a lot of those diets have omega-3s and just that are overall anti-inflammatory. Kidney disease, very similar diets that are meant to be restricted in protein and phosphorus. Our kidneys have to metabolize those things, and so if we can reduce the presence of those things in the food, it will make a big difference. Dental disease, so teeth is probably one of the things that contributes to worsening of heart disease more than anything else. So the same bacteria that or that pets have in their mouth are the same bacteria that create vegetative plaques in their heart, and so anything that we can do to help keep that bacteria under control in the mouth is going to keep it from spreading throughout the body. Most cats with kidney disease also have severe dental disease. Those bacteria end up in the kidneys and further the progression of kidney disease. So dental health is something that we want to start long before senior years, but definitely as we get into those senior years. Cognitive dysfunction. So this is very similar to Alzheimer's in people. It actually, cognitive dysfunction in dogs has the same type of deposits in blood vessels, brain matter, that Alzheimer's does in dogs. And so there's actually one of the images that we'll go through a little bit later goes over signs of cognitive dysfunction. And that absolutely can contribute to quality of life concerns. So we want to try to make sure that there are some options in terms of medications, actually hyperbaric oxygen, which is not available in Yankton, but if you're wanting to travel, it is available within 3 to 4 hours. So things that we don't always necessarily think about. Same thing, omega-3s, lots of supplements that we can do to help with brain function. And then obesity. So same thing as in people. Appropriate body mass is associated with longevity, and so we want to make sure that we're trying to keep our pets at their best weight. At home, like we talked about, joint supplements, heart, for arthritis, heart disease, certainly we want to be doing some supplements at home, medications that have been prescribed, that sort of thing. And same with kidney disease. For dental disease, so one of the things that that can help you select products when you are trying to manage dental disease at home is making sure that it has this, what's called the VOH seal, Veterinary Oral Health Council seal. That means that product has been tested to be effective either at reducing bacteria counts in the mouth and plaque. So plaque is bacteria, and then controlling that tartar buildup, which is basically a big matrix of plaque. So that VOH seal is a good thing. Sorry, back to arthritis here. So paw friction and the Dr. Busby's toe grips, there are other brands. Those are just two things that can certainly help with the grip of your pet when they're walking on harder floors. And then same thing for this Help 'em Up harness. There are a lot of harnesses out there. Help 'em Up harness is actually a fairly good brand. So it has padding typically where you want to have it. Cognitive dysfunction, snuffle mats, things like enrichment are really important. So anyway, so just trying to just talk about how we want to make sure that we're doing everything that we can to support our older kiddos at home. We also want to make sure that you're discussing all the supplements. It's very common to put pets on like turmeric, and so that often will cause GI ulcers, especially with some of our medications that we use. Same thing for like tryptophan and melatonin. Melatonin is a very common supplement that people give, especially in those aging pets that are showing signs of cognitive dysfunction. So yes, just make sure we have an open discussion with all supplements that you're giving your pet, so that your veterinarian is aware of. You know, we want to obviously avoid interaction. So that's not gonna help with quality of life. And then pills. So one of the big things that we run into with medicating our senior pets is that some of them may not want to take medications very well. And so definitely, speak with your veterinarian on that, because sometimes there are, like I think I have, but we'll use mini marshmallows, olives sometimes as different kind of treats. You can use bread with butter on it, plain white bread. So there are some different options that are still safe at home for their tummies. But there are compounding pharmacies as well that can make liquids and sometimes creams that can go in their ear. So if you have a kiddo that is not a big fan of pills, don't be afraid to say that, because when we send home a medication, we are thinking that that's being administered. And so if we know that it's not going to be effective, just, or even something that you can do long term, don't be afraid to say that. It'll likely change how we approach the care of that pet if pills are not an option long term, but that's okay. We don't get anything for your pet by sending those meds home with you and then not being able to administer them. So and then yes, there's no one size fits all approach. It is truly unique. Every kiddo has their own challenges. Every owner has their own challenges. And so it's finding what is going to be the best for both the owner and the pet. Because, you guys, as caregivers, it'll be that burden, that workload will be on you guys. And so yes, just some things to think about when we start caring for our older pets. So as we move into kind of thinking about, is the quality of life of our senior pet still appropriate? We want to first define good quality of life. So good quality of life means that our pets are still interested in engaging in all, or at least some, of their favorite activities. Good quality means that they have minimal pain and they look forward to interacting with their human family. It also means that they should be able to rest comfortably and sleep well. So that when we start thinking about quality of life, a lot of the questions that we'll start asking have to do with their interactions with you, the things that they enjoy, how well they're sleeping, that sort of thing. So when our emotions get a little bit, when our emotions get involved, obviously they're going to, we definitely lose objectivity. And so there are a lot of quality of life assessment forms that will help you document what exactly it is that you're seeing in your pet, to help you determine, is there still quality of life? Because those quality of life forms really focus on pain. I'm going to spend a couple slides on just going through symptoms of pain. Now these can be symptoms of cognitive dysfunction as well, but we want to, sometimes it's hard to distinguish whether it's pain or cognitive dysfunction. If it's there, it's not what we want. So changes in our daily habits, so those pets that used to eat great, and all of a sudden we're starting to see decreased appetite, No, this also goes back to why it's important to have that veterinary exam, is because there are medical reasons that can be managed that will cause these symptoms. But assuming we have all of our medical conditions well managed, like kidney disease, heart disease, that sort of thing, and we're trying to manage pain, these are some of the things that are gonna tell us that we are not quite meeting our pain control like we want to. So yes, if you have a pet that was oh, yes, ma'am.
Is this on a printout somewhere? This is very good. Is it in here?
It is, yes. And so there are.
I see the scale, but.
Yep, there are, and I apologize, they may not be in the same order,
Okay.
But yes, there are signs of pain.
Since they can't
Yes.
tell you, that this is a really good list of,
Yes.
what I would be watching for.
Yep.
So it's on a paper somewhere.
It is, yep. And if, I
Thank
was
you.
gonna say, and if we go through there and it's not, I can get, if we miss one, or we can always get you a printout of that, so.
Okay.
Yes, but yes, there should be a signs of pain list for both your cat and dog. So,
It's in the checklist.
yep, it's a little checklist, yep. So it'll say,
Just smaller. Let's see.
it should look like this IV.
Thank you.
If you were missing that, don't hesitate, we'll get you a copy.
Thank you.
Yes, yep.
Oh, on this side.
Okay.
My cat.
So,
Thank you very much.
yes, yeah, no, that's no problem. So, yes, decreased appetite, again, that's in your kiddos that were good eaters to begin with. We do have some pets that are never great eaters, so we're obviously looking for changes when we're talking about pain. Withdrawing from normal social interactions. If you have a pet that used to be out in the living room with you watching TV, they're no longer doing that, they're hiding in a room, they're hiding in their kennel, that's an abnormal social interaction. And so something has changed that has made them not want to have that social interaction. And typically that's a pain concern. Lapses in house training. So pets, they don't get mad at us, they don't potty inside because we told them no, that sort of thing. It is a stress response or it's a pain response. And so if we have very well-trained animals and they are all of a sudden having house accidents in the house, that's a pain concern. What we call self-mutilation, or self-mutilation, licking, biting, or scratching a particular body part. This is common in dogs, especially down lower on the legs. You'll see what looks like kind of a red or kind of bronzish color or stain. Sometimes we have iron in our saliva, so if we've been licking somewhere constantly, that's going to change the color of that hair. And so yes, that's also a common allergy thing. But if it happens to fall over a joint, that's typically pain. Cats will do this frequently over their rump or tail head area. Arthritis in their pelvis area is extremely common, and so something that we want to find or to see. Activity level changes, so just not moving like we used to as well, not being able to get up like we used to. If they used to jump from the floor to the table, and then all of a sudden now we're jumping from the floor to a chair to the table, that's a change. There's a reason that's happening. So just small changes like that. Posture, kind of a hunched or arched back indicates pain, same as us. When we don't feel well, we tend to hunch forward. If our pupils are always dilated, that is painful. We won't spend a lot of time on them, but we can definitely just kind of look at what's called the grimace scales for both dogs and cats. It's actually for rabbits, horses. They make them for guinea pigs as well. So it's not just, we're focused on a lot of dog and cat here, but this applies to all. Doesn't matter, yes, it doesn't matter the species. So changes in vocalization, so growling, yelping, grunting, things that if your cat never purred and all of a sudden they're 14 and all of a sudden they're purring, that's actually abnormal. So they will comfort purr to self-soothe. So things like that are important to note. And then being reactive. So it is common to hear that pets are all of a sudden biting as they get older. Usually they're being protective. So something hurts, they don't want you, touching them in a manner that hurts them, even if we're not being intentional on it, things just change sometime. So, so those are when we start to see biting, lunging, growling. That's a behavior change. That's definitely a concern for pain. I touched briefly on these grimace scales, but they're called grimace, so like facial grimace. But it's basically to watch the head position of your pet. So a happy head position is at the pain score of 0. As your pets start to kind of drop their head and ears, that's an indication of pain and discomfort. And so they are telling us that there is discomfort present. Same thing for the cat, 0, head up, ears up. And then as we go down the scale to get more painful, kind of those ears go down and our head goes down. This is something that I actually, when for one of my older cats that I euthanized, and it's at the very end, I did a little collage of just the pets that I've said goodbye to recently of my own. But in there, you'll notice that she actually has a grimace scale of like 2, indicating that she was in pain. Even though I have this talk with people several times per week, I still love my pets, and I still have a hard time objectively evaluating that at home. And so these can be hard things because you watch them constantly and you kind of get signs of hope. So eventually we do get to that point when we've kind of done all we can as our pet kiddos continue to age, and the time will come when all the love and attention and therapies and special foods really just are not enough to maintain good quality of life for our pet. So when we get to that, we start looking at these quality of life assessment scales, and these are in there just to help you and kind of read through them and think about them. There are different ones. There are a lot of different ones that are available, but it's meant to turn something subjective into more of an objective way to look at something. So this is called the scale. This is Dr. Villabus is a palliative care veterinarian, and so she had created this score basically that we are looking at is our pain control adequate in our pets? So are we seeing multiple signs of pain in our pet? Is our pet still interested in food? Is our pet able to maintain hydration? Are they able to maintain hygiene? Now, a lot of our older pets need some help when it comes to that, but most of the time we want our pets trying to do some of that themselves. Happiness, are they wagging their tail when you get to the door, that sort of thing. Mobility, that kind of goes with that hurt. Are they able to get up the stairs if they need to get up the stairs? Are they able to get outside and to go potty? And then, are we having more good days than bad? That's commonly something that you'll hear is, obviously we have to have more good than bad. At the point that bad outnumbers the good, we're in serious trouble for the quality of life of our pets. So this is just one form. Lap of Love also has a quality of life scale. And so these are just different veterinary groups that have helped put scales together. It might be a little bit hard to see up here, but there's a copy of this in your folder too. And like I said, if something is missing, just holler, and we've got extra, we can get a copy for you. But same kind of things. Are we having those normal social interactions? Are we excited when you get home? Do we want to eat? That sort of thing. And this one actually has there's a tally. So depending on how many things we check, if we're getting to the higher end of the scale, definitely our quality of life is a concern in a pet. And then they also have a daily assessment form. So, and you can do this on your calendar too, but it's a way to say, was this a good day or bad day? To have it spelled out per week, and they actually have a monthly form as well, so that again, we're just trying to make something that is very emotional and difficult into a little bit more objective way of just trying to decide if it's time. So the other one that is considered a quality of life is evaluating for cognitive dysfunction. And again, this is very similar to Alzheimer's patients and people. And so it can be a very sensitive subject because many of us do have family members that are suffering from those same types of conditions. But yes, we see with cognitive dysfunction, and it is important to note that this is not something that we would typically have you diagnose at home. We do want to make sure that we don't have other underlying health conditions that can be managed that are causing some of these concerns. So we call it more of a diagnosis of exclusion once we've ruled out other concerns. But and this is also in that folder, but when we were talking about cognitive dysfunction, big things are disorientation. A lot of us will describe our older pets, they go behind a bookshelf or they go behind the couch and they just stay there. They don't know how to get out. That they are, they'll go out into the yard, but then they don't come back. They just kind of stare. There's not really a whole lot of interaction, or when you're trying to get a hold of them, they're kind of just staring in the yard. Certainly they can become less responsive to your verbal cues, to your hand signals. Social interactions can become more fearful. So if they used to, love going to the dog park, now they're scared and kind of stay by the door. The gate, they don't really know what to do. We see this in vehicles, when pets used to love to go for a ride, now they no longer love to go for a ride. So pets that will pace and walk constantly at night that just are not able to sleep and rest. So kind of, where they lose house training ability, they have a whole lot more anxiety type concerns. And so most of us will have a pet that fits into some of these things. But when we start to score it, then if our score is really above that 16 mark, that's when quality of life is going to be affected, and we need to start trying to either manage that with medication or start going into that quality of life assessment for is that affecting, are we having more bad days than good? So yes, when we've gotten to the point when we have done all that we can, then definitely we are moving into the euthanasia process. We are gonna go through this in a little bit of detail here, just so that you're aware when you make that decision what you will be faced with. So where is it performed? There are home euthanasia services. We do that. Dr. Kleinschmidt does that for Kleinschmidt Veterinary Services. Those are probably going to be the two closest in Yankton, but there are veterinarians that will come to your home. There is a certain element of comfort knowing that your pet is where they are most comfortable, and so I think if that is an option, I would say that's always nice, is when you can do it at home. Where that may become a concern is a lot of times those are more scheduled euthanasias that you've been thinking about this and we're a couple weeks out. A lot of more emergent euthanasias or within a few days, realistically, those are more than likely going to have to come into a clinic for euthanasia. So yes, just be aware that both of those in the clinic and home can be either place. It's where you prefer. If it's going to be at home, it's something that most of the time is going to have to be planned out, more than a couple days ahead of time. So what is the process? So regardless of where it takes place, the process is going to be somewhat similar. It is going to vary based on the clinic clinic or veterinarian that you use, but you will always have to sign forms. We are required by law to make sure that any pet that we put to sleep has not bitten anybody within 10 days. And so that is that's a rabies concern. And it's not that, we don't ever think that your pet has bitten anybody, but it's just a question that we are required by law to ask. So you will see that question. So typically, I was gonna say, those forms are gonna be taken care of for the form to give us permission to euthanize has to be done first. Typically, we'll also fill out forms with how you would like to handle your pet after the euthanasia, whether that be cremation or home burial. Generally, those forms are gonna be done first. And then it's a little bit dependent on the pet owner. Sometimes we'll do a payment beforehand, sometimes it's afterwards. A lot of people like to be able to focus afterwards just on being with their pet and then leaving, and if you're at the clinic. And so don't be alarmed if that is presented to you, that I was gonna say that is part of that paperwork process. And again, this will vary a little bit based on the clinic that you choose, but most veterinarians will do some form of sedation. They will give an injection first to sedate them. It is meant to, that sedation will typically take a few minutes to take effect. It is meant to give your pet some peace and you time with your pet while they are in peace. A lot of these, like I said, a lot of these pets are in pain. And so, if they are three-legged moving around the room or yelping when they move a certain way, that's not what we want. When we do the euthanasia process, most of the time we are going to use a vein, which means we do have to have a leg extended. We have to position them in a particular way, and that can be uncomfortable. So the sedation is meant to help reduce any discomfort that they could feel from us having to reposition them. So once, typically there's gonna be sedation. Sometimes pets will be taken right back to have an IV catheter placed, and then brought back to the room with you. That way everything can just be done through a vein right away. At Lewis and Clark Vet Clinic, that's not typically, assuming I'm the veterinarian there, it's not typically how we'll do that. I prefer my pet to be with me all the time. I don't want them to be taken to the back for an IV catheter, so that's just where that preference came from for me. So I want to be with them at all times. So when I'm getting ready to say goodbye, I don't like sitting in the room, for 10 minutes or so while I wait for my pet to get an IV catheter. So that's just my preference on that. That's not to say that it's wrong. It's just a process that different clinics will follow. So the second injection is typically, so then once that sedation has taken effect, we'll come in and do a second injection. That second injection you will see is bright pink or bright blue. It is meant to be that way so that it does not get confused with any other medications. So it is a fluorescent blue or pink. And so that once that is given, and again, that is in a vein, and so that's where we have to do some repositioning sometimes to find a vein. But if our pet is sedated, they are not going to feel that. Once we give that second injection, it is typically very fast, generally within a minute or two until they pass. So, after that second injection, there will be, typically your pet is going to breathe faster for a few seconds before they pass. A veterinarian will listen to your pet to make sure that they have passed, and then we'll step out. That's a time for you to take as much time as you need. For some people, they may be ready to leave right away. Other people may want half an hour in there, and that's okay. It is for you and your pet. It's your final moments with your pet. So take the time that you need. Some questions that we get for during the process, should should an owner be present? So you will not be judged whether you choose to be present or not, so that's not something that we ever want you to feel. Some people will worry what we're thinking if you're not staying with your pet. Everybody is in their own stage of mind or state of mind. It is a very difficult process. So obviously you have to do what keeps you in a reasonable state of mind. Saying goodbye, is not, and it is never easy. It doesn't matter if you're on your first one or your 10th one. They're just, you don't want to lose your friend. If you can stay with your pet, I think that's a really great thing to do for your pet. They are the person you are the person that they've spent their entire life with, and so having that person is calming to them. If you are in a clinic where they do sedation, you can choose to stay through the sedation and then step out for the actual euthanasia. And so there's some wiggle room there on, if you want to be there for part of it or all of it. But even if you choose to be there for all of it, or if you don't choose to be there for all of it, we don't recommend that you take off their vest if they normally wear it, or their collar until after they pass away. Changing things like collar and clothing, they are going to notice that something is different right away. And so we want to leave as many things as we can just the same. Should children be present for the euthanasia? Ultimately, that is going to be up to you. From a veterinarian's perspective, children under 5, they don't tend to quite understand what is happening. That doesn't mean they can't be there. We just have to be a little bit aware that they may laugh. Sometimes they will poke pets. They just don't know what is happening. And so, if we make that decision to have children present, we just want to be aware that their reactions can be a little bit different than ours. The other thing, and this is very important, is if children are present, we typically will not use words like passed away. You've heard me say it multiple times. I'm the first person to use passed away or gone. It is hard for me to say dead, but with children, we do have to be very literal. So I will, in those cases, if children are in there, I will say, your pet is dead. The reason for that is that there are documented cases of children having sleep phobias when we tell them that their pet is simply falling asleep. So they take things very literally. It's the same thing we don't tell them that we're giving them an injection to fall asleep, because then they have anesthesia concerns, if they have to be under anesthesia. Also, things like saying they're going out to the farm, we don't try to use those euphemisms. It's very literal. Telling them that they're going over the rainbow, we don't want to say that. Children develop fears of rainbows and that sort of thing. So yes, if children are present, just be aware that the language that we'll use will change a little bit, because we want to make sure that we are being very clear on what is happening, and that we are not going to cause a fear to develop later in life. But yes, as to whether or not they should be present, there is some literature in those folders that will go through that, and ultimately that is your decision. Should other pets be present? So we actually recommend that they stay out of the room until after the process is completed. Some pets, we've seen some pets lick, some and kind of cuddle with their housemate. Other pets will readily step on them. Some pets will urinate on them. And so we want to make sure that none of those things are happening during the process. We want it to try to be as calm as we can. So just be mindful that if your other pets are there before they're sedated, yes, they respond to the emotions in the situation with a lot of anxiety, and so they will do things that they may not typically do. So the other thing too is just remember that even though we want our pets' euthanasia process to be as peaceful as possible, our pets' eyes will stay open. They may gasp, they may have a final gasp, they may urinate. They don't feel those things if they're sedated. So we just kind of have to keep in mind that, muscle tremors may be seen. That's a normal dying process. So it's alarming if you don't know that it could be coming, but it is a normal process. So, what can we do with our pet afterwards? It is, up to you on some people will choose burial, some people will choose cremation. Home burial, there is a pet cemetery. Winston Ray has a pet cemetery where they do their March graves. And so if we're doing home burial, we're just wanting to make sure that we follow city ordinances and that sort of thing, so we're not getting ourselves into trouble there. With cremation, it can be communal or private. Their communal is where their ashes will typically go to a memorial garden. It may not always be marked, you may not know where it is, but generally those ashes are going to be spread. I would recommend that you use a service that can at least tell you what happens with those ashes when you don't get them back. Most of us want to know that they've at least ended up into a flower garden or a memorial garden of some sort. So private cremation is when you get ashes back. It is when you, typically they will come back in an urn. There is, with regard to cremation, there is typical flame cremation, which is what is available in Yankton. There is what's called aquamation or water cremation. That is a process that you can expose your pets to water. So it's more of nature's, it's much more similar to nature's cycle if they are buried. You actually get more of your pet's remains back. The closest aquamation service though is in Omaha, Nebraska, at least for the time period. And so that is something that is out there. So yes, those are some options for aftercare. I just wanted to put a quote in here because we're talking about something that is so heartbreaking and such a privilege to have a pet that has made it to its senior years, and we've been able to enjoy those so many years. But yes, so this was Margaret Garber. But yes, if you have a dog, you will most likely outlive it. To get a dog is to open yourself to profound joy and prospectively equally profound sadness. But we often say when we're in the room that our pets will give us some of the best moments of our life, but also one of the worst. And so what we are trying to do with our quality of life forms and that sort of thing is to eliminate a lot of the grief and what ifs that come after you decide to put your pet down. Some people will leave with a feeling of peace. They will leave knowing without a doubt that it was the best thing that they could have done for their pet. Some people do not. Some people have a really hard time with that, and understandably. And so anything that you can do to help eliminate those what ifs is really helpful. There are associations, and I can always, if anybody wants the actual link emailed to them, the URL address, I certainly can. But if you, I was going to say, if you type in what is up here, it will take you to pet loss support resources. So people have harmed themselves after losing their pet. Obviously, that's never what we want. Some people just need to talk, and that's completely understandable. These groups will have pet loss support. Sometimes they are in the form of online chats. Sometimes they are in the form of a phone number. I put the names up here because the phone numbers are often run by volunteers, which means that you may or may not get a person if you call, which obviously if you're having a time where you need to speak with somebody, you may not want to leave a message. So, but typically the online chats are always active. Making sure that, we choose symbols of remembrance for our pets. So you can take locks of fur, you can do ink paw prints, you can do clay paw prints. It is good to have ideally we want to know those things before that procedure is done. But yes, have those items of remembrance. Kids really like to do like a remembrance table at home where you put pictures, colors, their collar, their leash, something to create a positive memory. So, and obviously, even if there are no children at home, those remembrance tables are still really meaningful. So, yes, anything that, any lock of fur, paw print, nose print, certainly let us know. You can plant trees and flowers, create photo books. There are garden urns. There's jewelry that can be done. There are so many different options for creating a good memory of your pet. So that is kind of our review of assessing when it's time and what that process looks like, and then afterwards. So, and yeah, so these are just some of my kiddos that I recently said goodbye to, and I'm not sure. Let's see here. Maybe I'm not, but this girl right here is the girl that I realized that I euthanized too late. By the time I decided to put her down, her facial expressions, her ears were down, her whiskers were down. I missed that she was in pain, and so yes, just one of those things. So, what kind of questions? I was going to say, hopefully, I haven't taken too much of your time, but yes, what kind of questions, thoughts? Does anybody have?
When you said the city ordinances, what?
Yeah, so like in Yankton, at least as far as where you are not supposed to be bearing pets within city limits. So, yes, so obviously that happens, that's not something that we have. Yeah, I mean, you can tell us you're gonna bury your pet if you live in the city. It's not anything that we're gonna do anything about, but we just wanna be mindful that yes, in the city of Yankton, that is not something that is gonna be a kosher thing with the local ordinance. So
Did
yes,
not know that.
yes, yeah, so, yes.
I have my own little graveyard.
Yes,
Like,
yep.
oops.
Yes, so I don't think anything would be, I don't foresee issues with that, but we don't want to have any of those issues either, so yes, so. One other thing I did want to mention, and I'm sorry, that with home burial is if it happens, if you are someone that has buried all of your pets at home and it happens to be January and the ground is frozen, speak to just speak to the veterinarian performing that procedure. A lot of times there's some, there are some options to hold your pet until the spring when the ground freezes. Generally those pets are gonna be placed in a freezer, but it would allow you to have your pet at home with you if that is what you prefer. So, some people, will know that is something that's coming and they'll dig a hole or prepare a hole beforehand. But if you don't know, just speak with your veterinarian about that. So.
you take care of yourself after
Yeah.
performing?
So I would like to, McKenna's one of the she's a technician at the clinic, and so, she hears me say a lot that, if a euthanasia ever stops bothering me, it's time to stop being it's time to stop being a veterinarian. It doesn't matter if that pet is in pain, or if it's not in pain, or for whatever reason, there is you kind of lose a little bit of your heart with every single one of those. And so, what I routinely tell myself is that I am helping that pet be at peace. And this sounds, and everybody's gonna take this a little bit a different way, but I euthanized Laverne, the guy in the middle, at the clinic. He is my total heart dog. Yeah, so when I think of dying, and they have those memes where you die and your pet is running towards you, like that is what I think of with him. But his Scott Lucan had painted a picture of him, and he is hanging in our euthanasia room, in our room. And in my mind, and what I hope is that he is there to help get everybody to peace. And so that's just how I think of it. And so every time I'm in there, I'm thankful that, and again, I was no way to show that this is true, but I'm thankful that I have somebody there that is helping all of these animals cross that bridge to be at peace. So yes, so to me, it's a way to say hi to him every time that happens. So yeah. But yeah. So that's how I do that. Yes. So yes.
Do customers, is that the right word? Come to
Clients,
you,
yeah.
clients, okay, come to you sometimes and say, no, he's in pain and I don't want to go through all these therapies and get prescriptions and different medicines. He's in pain, not eating well, not sleeping well. Can we just end it now? And what do you do then? Do you say, no, you gotta try?
So yes is the answer, is we can. So the hard part, we can stop there.
Oh,
So the hard part is that, and that's where that tailored approach really comes, is because some people will find that putting a feeding tube in and doing daily laser therapy and weekly acupuncture and meds is totally reasonable and well within what they can do and what they want to do. And other pet parents are not like that. And that's not to say one is wrong and one is right. Okay, but it's important to have realistic expectations. So if you know that you don't fall into that category where some people don't feel or believe that their pet should receive all of those. Some people don't want, just don't have the caregiver ability to do all of those things. If we have a pet that is in pain and needs help, and they are not able to receive help, we still can euthanize. If it is a young pet, so we typically will always have one or two kiddos that need a home at the clinic, because if it is a young pet that is experiencing a hardship and just needs some temporary help, and the owner is not able to currently do that, we will offer, and we will offer other alternatives, so we can try to find somebody that will help provide financial support for their care, so that we don't have to euthanize a young pet that just needs help. For our 17, 18, 19-year-old kiddos, that may be a little bit harder to do, because even though age isn't a disease, that kiddo has lived in a similar situation, similar environment their entire life. And so if we try to change that, there can be a whole lot of anxiety with that. And so yes, if you've got a kiddo that is in pain and discomfort, we will still euthanize, yes. So those are particularly hard. So because what I may want to do may not be the same thing that you want to do. But if that pet is in distress and discomfort, I don't want that pet being uncomfortable. There are times that we refer people elsewhere to do a euthanasia. Behavioral euthanasias are a common one, or euthanasias of convenience. That is, a euthanasia of convenience is one that's considered where, like, you're moving and you can't, you don't want the pet anymore. It may not be sick, but that's not a euthanasia that we would perform at the clinic. We can offer them some other options. Behavioral euthanasias, those are a whole different mix of emotions and extremely hard. But our policy is that we do require a documented behavioralist or a documented visit from a veterinary behavioralist recommending euthanasia. So because that means that pet owner has done something to try to address behavior concerns. And if all those adjustments have failed and the veterinary behavioralist feels like euthanasia is the only option, then we will do that. But that is also part of how I cover the emotional part of my brain that has to go home and sleep, is because then I'm not just euthanizing a pet just because.
Of convenience, it kind of
Yes.
falls into that
Yes.
category.
Yes, so.
A little bit, not
Yeah,
really.
it does though, it really does. So, cause right, we all have to do this day after day. And there are some days that there are 8 kiddos that we say goodbye to. There's some weeks that we don't have a kiddo that we say goodbye to, but those days that we have several, that is a hard day. And so it's a hard day for the pet parents who had to say goodbye, but it's a hard day for the team as well. And so yes, we try to make it so that the pets we did say goodbye to, they were in a condition that it was very fair to do so. Any other questions or?
Dr. Green helped me with a couple of my kids, and I'm not gonna cry. But I mean, as sad as it was really beautiful, and I didn't feel rushed, and I felt very supported. Like, there was a couple of times I came running into the office trying to determine quality of life and if it was time, and Dr. Green was always great with sitting down with me and giving me the time, even though she's super busy.
That's okay. That's okay. Because but it's really what, when you are a general practice veterinarian, it's what it's all about. So, because it's, it's that relationship, yes. So, what I can promise you is that none of your kiddos, that none of your kiddos are ever forgotten. There is not a kiddo that we've euthanized in the clinic that we haven't talked about a day down the road or months down the road. So we remember them. They are. We didn't live with them at home, but they become part of our work family too. And so yes. So.
Grateful for all of you.
Yes, thank you, yes, so, thank you very much.
All right.
Okay.
If there aren't any more questions, this is our second to last program in this series. Next month, we are going to have Jerry Weber here talking about how to move through grief. So yeah, if you life is a weird word to use. If you have enjoyed learning and talking about these difficult topics and you want to give some feedback, we have some little sheets here.
Okay.
If you don't mind. Otherwise, thank you very much, Dr. Green.
Yes, thank you guys.
Thank you.
Yes, of course, yes.
Now, where do I turn this in?
If you want to leave it there or drop it at the
Sounds
desk,
good.
whichever's good for you.
Okay, thank you so much.
Yeah,
Thank you.
That's right, just in case. That's all right, that's all right.
We are ready. Thank you, McKenna.
Fabulous.